I think this is really interesting to follow because if I was to say nurses are unrecognized labor in the United States, I think a lot of our listeners would think that I've lost my mind, right? But we did a national survey of critical care nurses. And indeed, when the pandemic first hit, the signs were up in the yards, lunches were going to the units. These are our healthcare workers. These are our healthcare heroes. But as the pandemic went on, things shifted. And it became less apparent that there was support in the community for what would actually help the healthcare workers doing this work. So ICU nurses in the survey describe caring for critically ill COVID patients, caring for patients that were dying at an incredibly high rate, no family present, attempting to connect family through iPads and iPhones to dying family members because they couldn't come into the hospital. And then they would stop at the grocery store on the way home. And people would be yelling that they didn't want to wear masks and they didn't want to follow public health guidelines and that their rights were being infringed upon. And they really describe the jarring nature of essentially putting their lives at risk and then not having people willing to do some of the things that would have helped slow COVID down. A person in the study described that healthcare workers are not heroes. We are human and we are scared. They talked about how incomprehensible it was to them that someone would be unwilling to be inconvenienced by a mask to protect the health of others, to protect others from not dying. And I just want to read, I think their words are more compelling than mine. It's hard enough to care for COVID patients, to see so much death, but to have to constantly validate the existence of COVID in my community is even worse. Seeing people living their lives like nothing is happening is a slap in the face to the ones who have died. The lack of national support and a community desire to assist in slowing community spread has made caring for patients with COVID unbearable. And so there was a recognition. And then over time, it went away and it really deepened, I think, the distress on workers, not just in the ICU, but across the healthcare environment.